We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
Hello, my name is Cristina Pastor, and welcome to Makilala. We are the longest-running Filipino-American talk show in the New York metro area. Funny how health assistance programs like Medicare and Medicaid are so loosely understood, and the only time we take the trouble of truly understanding what they are is when we reach a certain age and we are facing serious health problems. Do you have Medicare? It's usually the first question they ask in hospitals. Then you realize, oh shoot, why haven't I applied for Medicare? Or is it Medicaid? Or both? Can I apply for both? What is better for me? Here to explain the differences and similarities between Medicare and Medicaid is Geremy San Agustin, a licensed healthcare specialist who is knowledgeable about the health insurance industry and explains them to Filipino seniors at PACCAL, or the Pan American Concerned Citizens Action League. Also joining us is Marieta Lamar, the current president of PACCAL. On behalf of my co-host Rachelle Ocampo, welcome to Makilala, Jay and Marieta. So Marieta, let's start with you. Tell us about PACCAL and what do you do for seniors?
PACCAL was founded in 1992, and the very first members are mostly the veterans. Of course, the seniors, veterans, and we cater mostly with Filipino-American seniors of Jersey City. We normally have some kind of a workshop every Tuesday that we call it Healthy Heart, Healthy Family. We do it by Zoom. We normally have like about 30 people.
Oh, that's a big number.
Yes. And then we invite some professional, like, of course, Jay.
Jay, yeah.
We have some medical, like doctors, nurses, with like their specialty. Normally, they discuss about diabetes, hypertension.
So do you think that there are a lot of Filipino seniors who are not particularly knowledgeable about Medicare versus Medicaid?
Actually, Jay gave us a workshop, and he even does like one-to-one meeting with them, because they are all different problems, not problems, different needs of our seniors.
And this is all free services, free education for our seniors.
Yeah, that's right.
Yes, we even serve food while we're having the workshop.
Oh, really?
Yes.
So Jay, tell us, what are the key differences between Medicare and Medicaid?
Medicare is a government federal program that assists the senior community, and Medicaid is pretty much all, it's run by the state. Each state have their own Medicaid program, and basically they can work side by side together if the member is qualified.
Oh wait, Medicare, you have to be 65, right? To be able to apply, is that correct?
Actually, there's 4 ways to get Medicare.
Okay.
The first one is to be 65 and paying 10 years or 40 quarters to your Medicare taxes. That's the more traditional way. The second one is for the people who has below 65, who has disability. After the 24th month of getting SSDI, on the 25th month, they'll be eligible for Medicare. The third one is, have you seen those folks who goes to dialysis center, if they have ESRD, they can qualify for Medicare.
ESRD, what is that?
ESRD is the end-stage renal disease. Okay, they basically have their kidney issues, chronic problems. So on the fourth month of their dialysis, they will be entitled to Medicare. And the last one is ALS, or people know as Lou Gehrig's disease. Okay. Once you get diagnosed Lou Gehrig disease, no matter how old you are
Or how young?
or young you are, you will be eligible for Medicare immediately. There's no waiting period.
Rachelle, you have something in your mind?
Yeah, so this Medicaid, Medicare is such a huge topic, and it's so overwhelming to figure out how to navigate. And Cristina, your intro was so perfect. People don't really look into it until really almost too late. Even with my own parents, actually just this week, I asked my mom, it's like, Mommy, are you on Medicare? Like, I didn't know, you know?
Yeah.
And that helped open the conversation. And I think that's what's most important. How do you get seniors and people to go to your workshop?
Most of our workshops are pretty much published to the community organization I'm partnered with. And one of them is PACCAL in particular. They have a very active social media page that advertise in advance. We make it fun. We make sure it won't just be a workshop. We have prices for those. We serve great food. But at the same, most importantly, is our main goal is to educate them, make sure they know what plan that they're on. Because each and every one, like you said, have individual needs. You can be husband and wife, but you don't have the same needs.
So Geremy, tell us the difference between Medicare Part A, B, and C.
Okay, there's different parts of Medicare. I'm gonna make sure I'm gonna make it very brief and
Very
concise.
brief and understandable by people like us.
When you have original Medicare, you normally get Part A, which is hospital, hospice, skilled nursing facilities.
That
So-
means you're free?
No, not
Not
necessarily.
necessarily.
That's the biggest misconception. Just because we have Medicare, we think everything's free.
Oh,
So
okay.
each Part A has this year I have $1,600 deductible, and then after 60 days in the hospital, you'll be paying $400 a day.
A day?
A day.
Who can afford that?
Yes.
What's
Why
the
do
point
we
of
even have
Medicare?
why do we even have to get Medicare?
For the most part, Medicare only pays 90 days for the whole year. So after 90 days, you will be paying out of pocket. So with the Part B is what you call the doctors. The Part B has a premium. Premium meaning it's based on what you made. If you make a little too much money from 2 years ago, you're probably going to be faced with IRMA. Like IRMA is an extra added premium that you need to pay. So consult your IRS, your income tax. Make sure you don't get shocked with this Part B. But yes,
It has an impact on our taxes?
it does. Part B and IRMA it's an added premium that the government you're responsible for if you make money.
If you make
More money than they have a they base it on what you made 2 years ago.
So there's a threshold.
There's a threshold.
If you go past that threshold, then you
You
have
pay
to pay more
Yes.
because of what you got paid 2 years ago.
Correct.
So what is that threshold?
That's for example. For 2024, it changes every year, by the way. For example, if you make more than as a couple, if you make more than $206,000
$206,000.
as a couple, you'll be
right?
paying more than what a normal 174.70 rate, which is for this year for Part B. It will go all the way to $594, the maximum you're going to be paying a month. Not only that, it will get IRMA 2 for Part D, which is, I'm going to go transition to what it means. D, remember, D is for drugs.
For drugs, yeah.
Okay, Part D is for drugs. And then, with that being said, how are we going to be paying for all these extra charges that we weren't expecting that we're going to have? Like, for example, your Part B copay is 20%. What if my bill's $100,000? Where am I going to get the $20,000 to pay for it? So
how
you
do
you have
solve
two
that?
choices. Either go to a Medicare Advantage, which is Part C, or a Medicare Supplement, which is sometimes called Part E.
There's a Part E?
That's what they call it. Okay, a Part C, it's an option you should take, or a Part E, because if you don't take any Part C or Part D, you'll be stuck with this astronomical copays. Part C is a Medicare Advantage. It combines A, B, and D together by a private company. Part E is what you call the Medicare Supplement, which basically supplement whatever for a premium you will be paying. They will be paying the copays that Medicare is not paying. And there are some states, most of these Part E, the supplement, have underwriting. So there's a chance you may get declined. unless you live from one of these 4 states. New York's one of the states that is a guaranteed issue, by the way.
What does
So,
that mean?
Guaranteed issue means when you apply for a supplement, you will not be subjected to underwriting questions. You are guaranteed you're going to get it for a price. Of
So
course.
if you have a stroke and you get treated, you're not going to get that extra slap of
No, but
fees.
basically, when you're applying for Medicare and you have underlying pre-existing condition, they cannot decline you. The company cannot decline you. So New York is one of those states. Those 4 states are actually up here: Massachusetts, Maine, and Connecticut. So those are 4 guaranteed states in United States.
So, Marieta, PACCAL, have you been approached by seniors asking for help, financial help?
Like,
Like for-
financially?
Yeah, like for medical help for their medical issues?
Normally, what
Do you get
PACCAL
approached? Yeah.
help is if they need to apply for a low income, to be able to get a coupon for for groceries,
Like public benefits.
vouchers, yeah,
So you
yeah.
help navigate what their
Yeah,
options
no,
are.
Yes, it depends on what their problem.
But you don't
They
give
are
out,
all different.
but you don't give out cash or
No,
something.
no
like
cash
that.
because
Or else everyone will go to PACCAL. It's like, oh, why is it so
I'll
popular?
be I'll be going to PACCAL too if they'll give cash, right?
You know,
Actually,
there might be grants out there.
if I may, PACCAL do have a person who's a ship as a senior health insurance program in New Jersey who helps navigate them towards the Medicaid side for anything for financial, for medical needs. They have a person available to help them. I partner with her. She's actually pretty good. Her name is Annie. And she's very helpful to the seniors. And she's the one in charge of helping them apply for programs.
Anytime,
Yes.
anytime.
My
Yes.
first question is, when I hear all these services, like, and I asked it before, is it free? Like, can I go to you to talk about my parents and a situation and you can help us navigate? Or is there like a consultant fee?
Consultant fee is not allowed by Medicare, so no, we cannot charge. We're not allowed to charge. If anybody tries to charge you, please stay away from them, because we cannot charge, because we're doing this to make sure you guys are educated and you know what your plans are.
Are you doing this for the government?
I'm not doing this for the government. I'm just doing it as to the senior of the community.
Ah, okay. So I have another question that bothers me. If you're already on Medicare, why do you still have to get private insurance? Right?
100%.
And the biggest misconception is, I've paid all this Medicare tax all these years. Why do I need to get a private insurance?
Yeah, why do I need
If you
private insurance?
if you don't have private insurance, you don't have any out-of-pocket maximum. That means you're gonna put a hole in your pocket on your expenses.
I will be paying everything out of
Yes.
pocket.
20% can go a long way. The 2 choices that you have will lessen the bleeding from your medical expenses.
So Jay, it's 80% Medicare, and then the 20% is the other insurance, right?
That's not for the hospital. That's for the doctor charge.
Oh.
So that's
for
for Part B.
Medicaid.
For Part B, for Part B, you need to meet your deductible, which is $240 this year, and the rest of the year you pay 20% copay. By having a Medicare Advantage plan, you will be able to pay a specific copay, which less than 20%. If you opt to go to get a supplement, the supplement will pay for that 20%. So those are your options.
So the other insurance could be United Healthcare, Humana, and all this other. Okay.
Jay, when someone is about to approach you to get help, what information should they get ready to make the process easier? Like, you need their income, you need like their medical
Security.
issues,
Oh, yeah.
social security number. Like, what do we prepare to meet with you?
That's correct. We would need their income source, whether it be a pension or from work or from Social Security, assets. Government look at their assets, make sure they qualify the assets. Because believe it or not, there are programs available to our seniors with higher income base. For all these years, they would have been qualified if they knew about it. So there's a lot of programs out there that we're very aware of, that we're very happy to share it with them.
So I heard from some sources that when it comes to Medicaid, undocumented immigrants can avail of it. Is that correct?
Federally, no, they cannot do that. But there, as far as we know right now, as of June 2024, there are 6 states and Washington, D.C. have expanded their Medicaid service for undocumented immigrants.
Is New York part of it? New York, New Jersey.
New Jersey is not part of it, but New York expanded their Medicaid services for undocumented only for those 65 and over.
65.
If they're 65 and over and documented, as long as they meet the income range for Medicaid, they will be able to avail for this expanded Medicaid.
Meaning, as long as they can afford to pay the minimum fee.
No, there's no minimum fee because a Medicaid is basically it's an aid from the state to help for your medical needs.
Okay.
If you make more than the threshold, you will not qualify for it. There's a threshold they use. For New York, it's $1,275 a month. If you make more than $1,275 a month, you will not qualify for Medicaid. That goes to most of the states. That's the rate for this year.
So you cannot be both on Medicare and Medicaid, right?
Actually, yes, you can.
Isn't there like a dual program?
Actually, you're right. That's what we call it, dual.
A dual.
A dual program.
How do you know that?
I work at a community health center. Some of these things stick through.
Dual is what you call Medi-Medi.
Yeah.
Okay, Medi-Medi plan, a Medicare, Medicaid, or some call it DSNP plan, dual eligibles. Yes, you can have both as long as you meet the income threshold. Dual eligibles have more benefits. Not only they can get best of both worlds, they can get extra benefits. Like in New Jersey, for example, our dual eligibles can get as much as $300 extra a month for healthy grocery shopping. You
can get it in the form of not in cash.
No.
In terms of
Is that like
grocery?
Food stamp?
No, it's on top of the food stamp. You will get this. This is like what you call these are the Visa cards that they can use for shopping. As a matter of fact, we've helped a lot of PACCAL members qualify for Medicaid last year. Now they're enjoying these benefits because they can use it in ShopRite or H Mart.
Jay helps a lot of those seniors, yes.
So, Marieta, how many seniors have you helped in PACCAL? You've been around since the 1990s.
Just in Harbor View, that building, they said they have 80 seniors we have in there that are
they live there.
was helped by they live there in that building, Harbor View they call
You mean
it.
you house seniors?
They're like the building is like a low income.
It's like
It's a subsidized building.
Subsidized
But
by
at least
government.
70% Filipino population.
70%.
I was very surprised.
Yeah.
They have their Filipino events every Friday. It's very fun. They get to dress up with their barong.
Yeah,
Do they pay rent?
They do.
Do they pay rent?
I do, but it's
Very small amount.
Subsidized by the probably it's a low income
but those
building
are the
like.
people that need it the most.
Yes.
Yeah.
The services
Oh,
that
they
PACCAL,
screen it.
Yeah,
They screen
the
it.
services that PACCAL provides are for everyone, but those are the people who need it the most that really can't
low
avail
income,
the other things that they can
That's
afford.
right. That's right.
They
So-
screen it. Yeah.
Are you
qualify.
part of the screening process?
No.
I mean, is
No.
PACCAL part of it?
No.
No. Okay, right.
But we could refer.
You could refer.
Yes,
people.
a senior
okay.
citizen or whoever needs the help. Yeah.
So, is Medicare mandatory? Should we all be under Medicare?
If you decide to get Medicare in the future, you will be faced with and you didn't get it when you were supposed to, you can incur lifetime long penalties.
How much?
It depends on how many months you didn't have a Medicare when you were supposed to. So, in reality, is if you never took Medicare, you will not get any penalty.
Okay.
The only time you get a penalty when you decide, okay, I need Part D now. I need to help with my medication. But by not having Part D for 10 years, will be incurred with penalties as much as 33 cents per month for not having it. Lifetime.
Also, you can get Part D even if you don't have ABC.
No.
Okay.
The rules. There get rules.
There
Yeah.
are rules.
Okay.
Because that's all you need. For example, you just need
A
the
Part
drugs,
D,
right?
a Part D, you don't necessarily need to have you can either have Part A or B, but at least one of them to get a Part D.
Oh, okay.
What are the biggest challenges for Filipinos or your clients when applying for Medicare?
The biggest challenge is when they're about to retire, they actually tell me 3 days before they're retiring. So we want to make sure.
Just not the day before.
Yes.
Okay.
They want to make sure there's no our job is make sure they don't have any gap of coverage.
Okay.
So I have forms available for them to go to Social Security like yesterday. So make sure you fill this out. And some of the Social Security are very helpful. In the same day, they'll be able to approve their Part B.
So good.
But during the COVID time, it took 2 or 3 weeks for those things to happen. So during the COVID times is when we needed the most, because a lot of seniors decided not to go back to work anymore and decided to retire.
Yeah, just to retire. So
Yeah,
many.
that's
So
right.
we were giving them 2 to 3 weeks because nobody works in Social Security during those times. So it took a while to process them, and during that time there's a high influx of application for Part B.
But now it's much better.
Much better.
Not that we are encouraging people to wait 3 days before they retire, but it's possible. What are the other challenges other than waiting last minute?
The most challenging is their education, because they've been taught one thing. Because my friend told me this, my friend told me that.
We hear a lot of that, right?
But Facebook told me this. Facebook said they're going to give me $3,000. At least the most important is to give you the basic foundation of what you need. Let's start from the beginning. That's how we start the conversation. And I'm going to find out what are they looking for in the plan. Could be a good dental plan, could be a good out of pocket, good over the counter stuff. Because we need, before we can design a good plan for them, we want to make sure they know what are the basics.
So education is important.
Education
From the correct source.
Yes.
What is a good source that people can understand that we can go to?
The main source is Medicare.gov. Medicare.gov is our government source. Now, if you want to see programs, there is a website called Benefits Checkup. Okay.
Benefitscheckup.org.
Okay.
The org.
Yeah. Basically, just put in your zip code. These are the benefits available in your zip code. Can I apply for this assistance? Everything is there.
Wow.
So it's available all to the 50 states.
Okay.
It started by, I think, some group 20, 30 years ago. It's been growing as much.
So there are some politicians that are threatening to gut Medicare. What's going to happen if Medicare is abolished? If for some reason it is abolished.
Okay, let's make sure we understand the context first. Medicare currently is there's 67 million people in Medicare right now, mostly seniors and disability. If you're gonna take that out, that means they're gonna be losing all the benefits that they have. They're gonna be for those who are not Medicare age yet. We're going to be faced with higher medical expense. Hospitals are going to get financial shock because most of their patients are Medicare patients, and our
Nobody will be paying for it.
Our Medicare staff will be paid less. That means the quality will not be the same as we have right now, and they'll be opening new, and the quality of care won't be the same as we got right now. So it'll be big implication on a country like ours. It may work in different country. I highly doubt that it'll be work in the United States, because if they're gonna do a Medicare for all here, it's gonna cost the government around $92 trillion the next 10 years, which I don't think they're ready for right now.
Why shouldn't we Americans be entitled to free health care? It can be done in other countries. Why can't we do it here?
The reason for that is
We're greedy.
But what about like becoming social medicine?
yes.
Socialized.
That's what I'm talking about. We are, first of all, we have federal government, we have state government. In order for us to have we should only have one government. But right now, we have which is good because it checks checks and balances.
Yeah.
So we already make sure each state would run their insurance company differently. Because who runs the insurance company? Not the government. The states run their own insurance company.
It's not the insurance company. Insurance company in cahoots with the states. I didn't mean cahoots to sound negative, okay? In
No.
cooperation with the state.
Yeah, because states needs to have a very specific guidelines for these companies to run their business, especially when it comes to the Medicare space, because they need to make sure for them to operate as a Medicare Advantage plan or a Medicare supplement, they need to have a program better than Medicare, equally or better than Medicare. In order to operate, they need to follow specific guidelines.
Jay, we only have like a minute or
Sure.
two
Yeah.
left. what is or Cristina, do you have a last question? Because I was about
I
to.
wanted to ask, but I don't want to provoke Jake.
Do you think?
Do you think that healthcare has become a business in this country?
Healthcare has always been a business in this country, but this at the same time, our government is doing something about it. Okay,
How?
we have an Inflation Reduction Act that's what just passed the 2022, and it's continued to lower the prices of our medication for our seniors. 2026, all our expensive medication will have generics now for blood thinners and some diabetics medication. And next year, the government imposed a $2,000 cap on our prescription plan. So
I heard of that.
after you reach your $2,000 maximum, the rest of the year, your medication are going to be zero copay.
Do you agree?
My cap is $8,000 a year
A year?
right now.
In New Jersey.
Staten Island.
No, Manhattan.
Oh, Manhattan.
I mean New York.
Okay.
You have a cap. That's for your medical cap. At least you have a cap. If you have Virgin Medicare, you don't have a cap.
That's right.
She's like, oh, at least 8,000, not zero.
Yeah.
That's right. So do you agree that healthcare has become a business here?
Definitely.
Yeah, me too.
My thing is for both of you is, what is one thing that you want everyone to know about PACCAL? What is one thing that you want our viewers to know about Medicare?
There, very briefly.
Yes.
Okay, PACCAL is the best organization, I would say, for the tri-state. We in New Jersey, we have our own office.
Yeah.
We have grants that we use it for helping the people, giving them a lot of information like Medicare, Medicaid.
I'm sorry, Marieta, I have to run down.
Okay, I need to learn from you.
Yeah, that's right. We'll continue this off the camera.
Yes.
Okay.
So there you go. Medicare and Medicaid explained and analyzed. You have to be 65 or older with disabilities for Medicare and Medicaid, but Medicaid is only for seniors of a lower income level. Thanks so much, Jay and Marieta, for joining us, and to PACCAL for assisting Filipino seniors and veterans who need help navigating what it means to grow old in our society. There are a few organizations that are doing a great job that you do. And to our viewers, thanks for watching.